nurse today. I'm just doing some hand hygiene. Can you go ahead and verify your name and date of birth?
Yeah, my name is Abdominal. I was born March 24th, 1998.
Great. And what we're doing today, Abby?
I'm having pain in my right knee.
Pain in your right knee. And about when did that happen?
3 days ago.
3 days ago? Okay. And it's in your right knee? Okay. And do you have any pain associated with that?
Not really. It kind of radiates up my leg.
Up your leg? Okay. And what would you characterize that pain as?
Throbbing.
Throbbing.
Yeah.
And on a scale from 0 to 10, how much is that?
Probably 6.
6. Is there anything that aggravates that pain?
Like walking or running or something.
And do you have anything that you use to relieve the pain?
I try to ice it for like 20 minutes, and then I also take Tylenol.
And Tylenol. And how much Tylenol do you take?
2 pills.
2 pills. And do you know if it's over the counter or prescription?
It's over the counter.
Over the counter. Okay. And what is the pain like after medication?
It's probably like a 3 or 4.
3 to 4 after medication versus a 5 out of 10.
Mm-hmm.
Okay. And have you been seen for this before? Is this your first time? Okay. Great. So I'm just gonna go ahead and just do a head to toe, make sure that your basic health is in check to get you a baseline, and see if any of that is contributing to your okay. So first thing I'm going to do is just inspect your head, okay? I'm just going to be looking for symmetry, looking if there's any abnormalities. I'm going to go ahead and palpate your scalp. Let me know if you feel any tightness. So I'm not feeling any lumps or bumps. Your hair is nice and soft, not dry or coarse. Then go ahead and take a look at your face, looking for symmetry. It looks like you have a nose ring and a couple moles on your face. Have you had any problems with those or noticed any changes?
No, but they're only on one side of my face, which is kind of weird.
Okay, it's good to know. I'm going to be assessing your cranial nerve 7. Can you go ahead and squeeze your eyes shut for me? Keep open, and then puff out your cheeks, smile, and frown. The lips and nose intact. Great. I'm going to go ahead and palpate your sinuses. Is that okay? Let me know if there's any tightness. I'll be assessing your cranial nerve 7, so I'm going to ask you to clench your jaws. Great. And again. Awesome. I'm going to go ahead and look at your eyes now, okay? So I'm going to be shining a light in your eyes and look at your pupillary relaxation. So go ahead and just stare straight at me. Great. Nice and equal reactive to light, and they're accommodating or consensually. I'm going to go ahead and just take a look. Oh, I have to make sure that your ocular movements are intact. So I'm going to have you stare at this pen light and try not to move your head at all. Just follow with your eyes. This is just letting you know that your cranial nerves 4 and 6 are intact, that your eyes can move. Great. And follow it in. Great. Looks good. So I'm going to go ahead and just assess your nose. Like I said, you have a nosing on your right side. Has it been troubling you at all? Have you had any trouble smelling? I'm going to ask you to just go ahead and take a sniff out of this and tell me what scent you think it is, alright? Open.
Spearmint?
Yep. Making sure that I know that too. I'm going to go ahead and just take a look in your mouth, alright? So, first thing I'll do is have you take a big smile for me. I'm going to be looking at your teeth. They look nice and white. I'm not noticing any sort of cracks or decay, and your gums look nice and pink. I'm going to have you stick out your tongue for me. Good. Nice and pink. I'm using a tongue depressor and a pen light, okay? I'm just going to have you open your mouth and say, ah. Okay, what I'm looking for is your pharynx is nice and pink, that your uvula, your tonsillar pillars are rising symmetrically. Can you go ahead and push your tongue up either side of your cheek? Great. So, next I'm just going to be taking a look at your neck, alright? Looking if it's symmetrical, looking for any lumps or bumps. I'm going to palpate your trachea, alright? Just looking for any deviations, and it looks fine. I'm going to be assessing your carotid pulse, okay? Great, it's nice and strong, no irregularities. Nice and two plus. Same thing other side, strong, no irregularities. I'm going to take a look at your ears, okay? I'm going to look if there's any redness or lump. I'm just going to be touching them, okay? I'm assessing if there's any masses or is there any tenderness in my touch? Okay. And if you can hear me, raise your right hand. Okay, so your loud speech is totally intact. I'm going to be whispering in your ear, so let me just repeat after me, okay?
6. 8.
Great. So your cranial 8 is intact. I'm going to go ahead and I'm going to move on to your respiratory, okay? And have you had any wheezing or shortness of breath lately? Have you had any coughing? capping up mucus or blood? No. Okay. So I'm gonna go ahead and just insert your chest, alright?
I'm gonna turn.
Yep. Thank you. Just looking at it. I'm gonna pull up your shirt a little bit if that's okay. And you've got some moles on your back. Have you noticed any changes in those? No. Okay. I'm just have you take a deep breath in and out. Great. I'm looking at your expansion. You look good. Okay. And then I'm gonna go ahead and take some listens to your breath. So anytime I said it's okay with you, just go ahead and take a deep breath in and out. Okay.
So what brings you in here? You hurt your knee. Which knee?
The right one?
When did this begin?
Yesterday. I tripped and fell on it.
Bill, were you doing anything? Were you just walking?
I was just walking. I didn't see where I was going. I tripped.
Okay. Where on your knee?
I'll have you lift up your shirt a little
Right on
bit.
the front of your knee. Does it hurt more when you're walking on it? Does it hurt more, or does it always hurt?
It always hurts.
Great. And I'll put your hands on your sides.
How
And
would you
listen to
describe
your
it?
side.
Sharp.
Sharp. What would you rate your pain on a scale from
4.
4? Is there anything associated with
I'm gonna go ahead and listen to the back of you, okay?
I'm so sorry. You done anything to relieve the pain?
Yeah, ice and ibuprofen.
How often do you have ice?
For 20 minutes.
For 20 minutes. And what dosage of ibuprofen?
400 milligrams.
How often do you take it?
Morning and then night.
Okay.
I'm just gonna
And
lift
you
your
take
shirt
it
up a little
orally?
bit, okay?
Okay. Have you had any problems before that you've seen a doctor for?
No.
Okay. Well, thank you for answering my questions. I'm gonna begin the head to toe assessment just to check everything out, okay?
Okay.
Okay, so first I'm gonna inspect your facial features.
Great. Your breath sounds are nice and clear auscultation. I'm not hearing any sort of abnormal sounds.
Tell me if this
And
no numbness.
I'm gonna move on to your cardiac. Have you been feeling any chest
So now I'm
pains?
gonna have you close
Any
your eyes for me,
dizziness?
please.
Any
Puff your
flutters
cheeks
or
out.
palpitations in your chest?
Perfect.
Have you noticed any
I'm just
swelling
writing
in any of your
this test to
extremities?
assess your
Just in my
cranial
ears.
nerves.
Just in your
Okay,
ears.
that's cranial nerves.
So I'm gonna go ahead and take a listen to your cardiac sound, okay? So I
So
should
now I'm
be
gonna
listening
get
to your
a
second
little
across the space on your right side, very aortic.
And I want you to tell me, I want you to close your eyes and tell me
Great,
if you
nice
feel
one. I
sharp
heard
or
sounds.
dull.
No murmurs. Going over to the left, second intercostal space.
Sure.
Your pulmonary
Excellent,
valve
thank
sounds
you.
nice and clear, 1 and 2. I'm gonna move and have you pull down your shirt or
Now
lift it
I'm
up
gonna
as much as you
palpate
can.
your
I'm
sides.
gonna have you.
Oh,
Yeah.
yup.
Any drainage, any
I'm
problems
gonna be
that you
counting
realize
down
your
to
sinuses?
the
No.
5th intercostal space in
Okay.
your sternal line.
So now I'm going to look at your eyes, if you have any
Great, your
problems with your eyes.
That's great. And I'm gonna have you lift up your breast a little bit
So
and here at
first,
your
I'm just
midclavicular
gonna
line
shine
at the
this
same
light
5th
in your
intercostal
eye.
space.
I'm gonna assess your pupillary response, okay?
Your mitral valve sounds nice and clear, 1 and 2. Great. And I'm gonna go ahead and assess for some edema. What I'm looking for is any abnormal
So
swelling
now
or
I'm
pitting
gonna
when I
have you
press down.
Keep your head still
Okay.
and follow this
Same thing with
point
your
of
legs.
Okay.
Okay. So I'm gonna go ahead and take your radial pulse.
And then I'm just gonna have you
Okay,
continue
it's nice
following
and strong, no irregularities. Same thing on this side. Nice and strong. Okay. I'm gonna be checking for some capillary refill.
Excellent, thank you. Now I'm going to
I'm
inspect
gonna do
your
2
ear.
seconds. That lets me know that your blood flow is adequate to your fingers.
Okay, do you have any
Okay, so I'm gonna be moving on to your abdominal. So I'll have you lay down and pull up your shirt.
I'm going to irritate your mouth, so I'll have you open your mouth for me.
Okay, so I'm gonna take a look at it. You've got a mole here on your left lower quadrant. Have you noticed any changes in that?
Pink and moist.
Okay.
I'll have
And I'm
you
just gonna take a
move
look
your
and
tongue
it's
from side to side.
nice and soft.
Just
There's no
to move your
abnormalities
mouth
other than
base.
the mole, which isn't too bad.
That
It's
assesses
nice and
the
flat.
cranial nerve 12.
So I'm gonna go ahead and take a listen
So
to
now
your
I'm gonna
pulse,
palpate your
okay?
nose. Do you have any difficulty smelling anything?
No.
Do you have any unusual drainage that you're concerned about?
No.
No? Okay. So now I'm gonna inspect your neck. Have you noticed any problems with your neck recently?
No.
Okay. So I'm gonna palpate for your trachea. Have you swallowed for me? Thank you. I'm gonna find your carotid pulse. So it's a normal pulse, good.
Okay, you've got some nice
So
normal
now I'm
pulse
going
sounds
to
every 3 to 5
listen
seconds.
to your breathing sounds.
Okay.
Have you had any
So first I'm gonna
concerns with
inspect
your weight or
the front of your chest.
what about bowel movements? Any problems with that? What's
No,
your
actually have you turn
Yes,
this way for me, please.
yesterday, okay. And do you pass gas?
Have you noticed any
Yeah.
lumps
Okay.
or tenderness?
Great. So I'm gonna go ahead and just palpate your sternum, letting me know think that's okay.
I'm just gonna go to the back.
What I'm looking for is whether or not she feels any tenderness or any masses. I'm gonna go a little deeper, okay?
Okay, so now I'm gonna test for symmetric.
So it's nice and soft and pliable. I'm not feeling any masses. It doesn't look like she's feeling any tenderness either. So I'll go ahead and have you sit up for me. And I'll be assessing just your muscles. Okay. So I'm gonna have you rotate your shoulders as best you can in the other way. Great. Let's know the good range of motion for your shoulders. I'm gonna have you push against my hands already. Okay. So you got some nice strength. I'm gonna go ahead and go down your arms. Assessing again for edema or swelling. And then I'm gonna have you go ahead and stick your arms out and turn them over like you're pouring out a can. Great. And then put your elbows up over your head. And then again, bend them down. Ooh. Great. Once you know the range of motion in your elbows as well. Can I have you stick out your palms like this? Rotate them. And then again, rotate your wrists the other way. I'll have you stick out your hands like this. Close them. And then open them again. Awesome. And then go up with your palms. And then that's great. Nice range of motion for your wrists as well. And then I'm going to go ahead and assess your legs as well, okay? Just looking for, again, for edema or swelling. Checking the temperature, like nice and warm. I'm going to go ahead and have you push against my hands. And then pull against my hands. Great. I'm going to go ahead and check your pulse, okay? It's a little bit faint, but it's still there. Same on this side. Same thing. It's a little bit faint, but I can still feel it. It's pretty normal for your feet. I'm going to go ahead and have you push against my hands, okay? And then pull my hands. And I'll have you grip my fingers as best you can. Great. Some nice strength. And I'll have you lift this leg up for 5 seconds. 2, 4, 5. Awesome. And then again, this one for 5 seconds. 1, 2, 3, 4, 5. I'm going to go ahead and assess some sensational feelings, letting you know that your nerves are intact, okay? I'm going to go ahead and go from your face first. Let me know if this is soft. Go ahead and check.
4 different areas of your heart.
This one.
So I'll let you know whenever, or what
And
area.
this? What is this? Soft or sharp?
Sharp.
Soft or sharp?
Sure.
Okay. I'm going to do the same thing with your arms, okay?
First, I'm going to listen to the mitral
Soft or sharp?
valve.
Soft. Sure.
I'm going to listen to
Okay, same thing with your legs, okay?
valve at the left sternal border.
Soft or sharp?
Soft.
Okay.
I'm going to listen to
Sure.
the pulmonic valve.
Sure.
The second
And I know with your
left
feet.
intercostal space.
Soft. Sure.
Okay, great.
Now I'm gonna listen to
So
the
next
heart.
thing, I know. You did great. I'm gonna have you do some walking movements for me, okay? So we're gonna take a step up. I'll have you walk to this next bench, just normal gait.
Have you
I'm just assessing how she's walking, if it's symmetrical. And then when you walk back to me, walk heel to toe like you're on a tightrope. Awesome. She's got some nice
I
balance.
stepped on my own toe.
Great, nice coordination.
um,
Now have you turn around for me and bend forward as far as you can. And then I'm looking for any deviations in your spine or curvature, any raising of one side. I'll have you go ahead and stand up for me and then lean back as far as you can. Just checking some range of motion for your spine. Turn to your left.
I'm going to listen to 4
And then
different
go ahead and turn to the right. Great. Some nice range of motion. Now go ahead and sit down. So that concludes our examination for today. Looks like you're all in good check. How's your knee feeling though after moving around?
It's not too bad.
Okay, just want to make sure it wasn't activated at all. All of your normal findings. I'm not seeing anything abnormal, so I'm going to go ahead and just chart this and let the doctor know you can go ahead and take a further examination of your knee. Do you have any questions?
No.
Okay, do you have any concerns at all before I go?
No.
Okay, thank you so much, and I'll see you in a little bit.